Hello and welcome to Asake Online. My name is Lesley Moyo, and the name of the program is On the Pulse, where we focus on service delivery issues affecting the Matabeleland region. In today's edition of the program, we visit Luveve suburb, one of the oldest suburbs here in Bulawayo, where there's been an outbreak of diarrhea disease. The city of Bulawayo has done tests and it has proven that there was indeed an outbreak of typhoid as well as dysentery, which has claimed 13 lives and affected over 1,500 local residents here in Luveve. Today we had an opportunity to tour Luveve Clinic, which is the center where residents are being treated for the disease. Some of those who are worst affected are being transferred to referral hospitals like Mpiro Central Hospital. The sisters in charge here, they explained to us the process of how they are attending to the patients, as well as the city's health department also informed us about how they are doing their outreach programs to residents here to educate them about how they can take care of themselves in the midst of this outbreak.
Those who needed to be referred to the hospital will be leaving from this one.
So kathesi ligcineni ukuthola labade befuna serious attention sibili bona bokudiarrheal
Izola sibanga la yami. But I think it's the day before yesterday.
so meaning to say maybe
The numbers are
number
now
is
going.
dropping.
Yes,
Yeah,
numbers are
numbers
going.
they are going down. Although we are still seeing how many new cases.
So what is in place, because I want to know we receive how do we get the information from households ukuthi bakhona bagulayo abantu abasinasekhaya lapho kuthi siyanduma umuntu azihlalele. So what measures do we have ukuthi we work with the community to bring those people on board to attend?
We had two MP here who also alerted us, was giving us addresses, and we sent our teams to go into those our houses where we were directed. And we've also got community health workers. We've also got Omama Bomus. So they're also guiding us whichever direction we have to go. You know, my residents, they would report if there's anyone who's sick and unable to come. And we did find those who were unable to go anywhere really, and we treated them in their homes. Diarrheal, simnika look
Prescribe according to the case.
prescribe according to the case. Yeah. So abanye ngoba abanye isihudo kuphela, ezabanye isihudo esilegazi, abanye njalo kube izisu ezibuhlungu nje bengahudi. So uyahlangana lezinto ezitshiyeneyo esinjalo.
Developmental partners have also come in to assist the Bulawayo City Council to deal with this outbreak. We also get to hear from organizations like the Danish Church Aid who have come through to assist the local authority to contain the spread of this outbreak.
We have been working with Bulawayo City Council on a number of activities now. I'm sure you are aware and you have seen water kiosks in a number of suburbs where we are responding to the water crisis that Bulawayo is facing, and that crisis is real and we need to do something. And as Danish Church Aid, we got some resources, and so far we have done 5, and the last one is in Bulman. I'm sure it will be up and running next week. And we also have a number of cash transfers that are happening within Bulawayo. And just yesterday I was in Tumbano when people were swiping and buying their first groceries. But that's what we are doing as Danish Church Aid. And we are redefining how things should be done in Bulawayo. And on this one, we are partnering with Care International. We are also partnering with Plan International. Us, we are Danish Church Aid, but our donor is European Union. So in response to the diarrheal situation that we are facing in 115, we partnered with these organizations that I've just mentioned to also donate something. We are aware that Morit has done something in Ward 15, and we also felt that we need to do something in Bulawayo. And in that gesture, we are going to donate 1,500 of the bucket, and we are also going to donate 1,220 of these water containers. So that means each household will get this container and this bucket. Okay. So far, we have conducted registrations, door-to-door registrations. Because of COVID-19, we couldn't bring people together, so we had to hire people to do door-to-door registrations. And we have registered 590, and from Monday next week, we are going to start those distributions so that at least people would access containers that will make sure that they keep their water safe. At the same time, they also wash their hands. So, kanyangani sichainyone zimbili la one COVID-19 esithi thina abantu kumele bageze ini izandla, and then le diarrhea esithi thina amanzi awahlale ehlanzekile, egcinwe njani ehlanzekile, abantu banathe amanzi ahlanzekileyo. So yikho okuncane esilakho as Danish Church Aid lama partners lawa engiwaqambileyo ukuthi sincedise lathi umphakathi wokubulawayo Ward 15. So ngamafitshane ngiyabonga.
Siyabonga. Namhlanje izandla.
I think you are all aware that I've been sent by the mayor, so you'll allow me to read so that I make sure that I say what the mayor said, not what I will say. The chairperson of Health, Housing and Education Committee, Councillor Umama Umamlilo, the councillor of the area, Umama F. Msipa, Umama Msipa, ubethwele nzima nje. Ekhathazekile zakhamizi Luveve, if you are here, members of the media, please tell the residents of Luveve that even their councillor could not sleep. She would phone mayor, phone everyone at night. But well, we really appreciate your stance Njengwa Mama. You stood with your people. This is what we really appreciate. Together, Mama Wami, Councillor M. Ngube from Ward 16, which is Kwabalanda, which is also serviced by the same clinic here. And you know that if we face challenges of diarrhea, chances of it spilling to Ward 16, it's very high. So we are asking our partners to always help us put the ear on the ground so that when something like that happens, which we don't wish it to happen, we arrest it as a matter of emergency. The Director of Health Services, Dr. Isbanda, represented by Malaba, the representative of the Danish Church Aid, and we have got some partners that I had them being mentioned here, including American Association. We really appreciate your presence. We know if you had not come on board when the pandemic started, but well, with your assistance, you came on board and you helped us. We remember some residents association, some members of the media actually camped in this ward. It really assisted us in receiving information. We really appreciate that. Our esteemed honorable member of parliament. I will not say she's representing Honorable Stella Ndlovu because she does not have a constituency. She's an MP for the province, so meaning to say wherever she stands, she's a member of parliament. She's a member of parliament for Bulawayo Metropolitan Province, Honorable Tofa. We know she called me around 5 a.m. when people started to talk about Luveve, and then the answer was that I'm not a councillor for what 15. Then I gave a number Councillor Msipa. We really appreciate. Also send our thanks to Honorable Ndlovu that we know she was here as if she was a nurse, helping our members of the staff to administer medical attention to the affected people. Our invited guests, ladies and gentlemen, we are greatly humbled to receive these donations today at the Luveve Clinic aimed at assisting the residents during the outbreak. The city of Bulawayo appreciates the gesture particularly at this time when we are facing the diarrhea problem. I would like to send my deepest condolences to those of you that lost their loved ones because of the disease, of this disease. This is really from the bottom of our heart as the city of Bulawayo. Sikhala laba balahlekelwa izihlobo zabo. Azange sifise kwakungasokuthanda komuntu kodwa kwenzakala. Sithi hayi bantu bakithi uNkulunkulu uyapha, uNkulunkulu uyathatha. We will try our best if we can, if we've got power to avoid such things to happen if it becomes a human error. But in addition to that, the lives of the people of Bulawayo are important to us, and we'll do everything in our power to ensure that this issue is resolved so that we continue being the council that you deadly love. I think members of the media, you all know that we've got efforts that we are doing to try and correct the problem and see where the problem is, or this diarrhea thing, and also to save lives. This is why you see our partners like Danish Church Aid has come to assist us. It's a sign that we love people and Bulawayo life matters. May I take this opportunity to appreciate the donations we are receiving today from Danish Church Aid, who have seen a need and acted upon it. The Danish Church Aid are a great partner of this city through the various activities and programs that they are doing in Bulawayo. I'm glad that you have quickly seen the need for assisting the Luveve community despite in being out of your project areas. Bulawayo City Council extends its appreciation not only of the water containers being handed out to us today, but for the 6 water kiosks that you have assisted the city in critical areas where water supply is a challenge. You know, we are setting up water kiosks all over the city where we've got serious water challenges. But our good friends have assisted us. They've put some in other wards, which I think it's what 27 and also in what 18, somewhere there. We do have kiosks from the Danish Church Aid. May I extend my appreciation for the water containers that are for the Luveve community, which will ensure that community members have more containers in which to safely store water during periods of water shedding. The city is continuing to attend to residents for diarrhea treatment at no cost, and we are encouraging early health-seeking behavior to ensure that there are no complications to the health and well-being of the residents. Luveve suburb is still exempted from water shedding to ensure constant water supply. We are also working on problematic sewer outfalls, which had become a breeding ground for vermin. May I argue the community to work with council in protecting the infrastructure and being rehabilitated. Ladies and gentlemen, may I once again appreciate the donors and partners for the generosity. I thank you. Siyabonga.
My name is Jasmine Tofa, Member of Parliament for Bulawayo Metropolitan. On behalf of Honorable Stella Ndlovu and on behalf of all the legislators in Bulawayo and the people of Bulawayo, sithanda ukubonga kakhulu this gift by Danish Church Aid, right? Danish Church Aid, labanye bonke abahlanganise izandla ukuthi uBulawayo aphile, or in particular uLuveve aphile. Okuqhakathekileyo kayisikho ukuthi into inkulu okunganani. Every little cent counts and matters. Izolo besisempilo kulama referees Bulawayo Referees Association labo benika bus fare to ama patients ade ekhona esibhedlela. I think there were about 6 of them. So we are really grateful with this gift that you have given our community, and we ask that God bless you, and I'm sure He will bless you. Lapho okuphume lokho kwandiswe. Yes, siyabonga. Sicela ukuthi sibonge kakhulu ama-nurse at the clinic and other clinics. You are one of the most important people that are helping us survive, or helping our communities to survive. And in most times we forget to thank you. You are really special, and we will do our best in whatever form we can to make sure that our frontliners bathole ama PPEs abo, and also that they get whatever else they do need. As legislators, lathi siyabe sikhuluma eParliament, sisenza oversight role yethu. So we'd really like to thank you, and for you to know that every day and every time that we have an opportunity, we do represent you. And please make sure you also advise us as your legislators as to what it is your needs are. I actually also do belong to the Health Committee, Portfolio Committee in Parliament. I'd really like to say thank you very much. Your donation is really is going to go a long way to help the community. Thank you very much.
And I will start by saying I'm so happy in a sad situation today. The fact that we are here, those who came early, we had a mini tour of the clinic. We even toured the grounds there. And why I'm happy is because when we toured, we went to the other side, it's only tents which are empty. But at one stage, the situation which was here was terrible. Never at any stage have you even think or thought of putting some tents or setting up some tents on these grounds, because the facilities here were expected to be adequate for whatever conditions are around. But there came a time, because of this outbreak, that we had to set up some tents outside. But I'm happy to say those tents today are empty, and some have been dismantled. The reason being that I believe with the effort of everyone, the donors, the leadership, political leadership, and the workers, everyone has put in effort, and I think we are beginning to see some, or I'm happy to say, the number of cases who are attending per day are now going down. It means all our efforts were not in vain. So that's why I'm saying I'm happy to see that there is quite a great improvement. The situation here was so bad. No wonder why people were angry. It's expected. They were angry, obviously, because if you are feeling the pains, you may think that maybe the other person is not caring or does not care about the situation. But it was not the case. That's why it's called an outbreak. It's an emergency. No one is ever prepared for such an eventuality. That's why it comes as a surprise. You only expect a certain number of patients to come through the clinic on a particular day. But when we start, all of a sudden you find 200 people coming for a particular condition, it becomes a problem. So I'm happy to say with our partners, Mr. Moyo said we are redefining, for sure it's redefining. I never imagined that in Bulawayo we'll be worried about carrying buckets and izigubhu usiyadinga amanzi emthonjeni kumbe wherever you're doing. But things do happen, isn't it? So like the COVID-19 issue, we were talking, sigqoke sisivala amakhala lomlomo, all those things are just things which do happen. And so, but I'm happy that people are always prepared to come in and assist so that we minimize the effect of a particular a condition which will be actually which would be facing at a particular time. And I think those who obviously talked about 590, I know that the population of Luveve is much higher than that. And the honorable MP said no donation is small or no donation is too big. So we definitely can't manage to get, or to manage to assist each and every resident. But for those who have been assisted, I think they represent the rest of the community. Let's be happy. I hope the residents are around. Let's be happy for those who got, because it also minimizes, isn't it? So we encourage those who receive to collect their water whenever water is there, properly store their water, make sure the container is always closed, is clean. Then they also must make sure that they wash their hands. And at the moment, with the challenges of the water shedding, obviously we cannot assure proper, if it's not continuously flowing, then there may be interference with the quality of the water. We're not saying our water has got a problem, but because of the shedding, there's a time where the pipes will be empty. So a lot could happen. So make sure that whenever you receive water, for 55 minutes, you just drain so that you clear the whatever, any deposits. And whatever water you collect after, please, at the moment, we are insisting that for drinking purposes, please boil your water. Boil your water, then cool it, keep it, then drink it. After boiling, also make sure after cooling, you keep it properly, because you can still boil and still improperly store it, and it becomes contaminated. We still have the same problems. Like I said, mine was, I got carried away, but mine was just to say thank you very much for the donations, and thank you very much for everyone. Thank you.
We do hope that the Bulawayo City Council, in partnership with the government of Zimbabwe, as well as other developmental agencies, will be able to arrest the spread of this diarrheal disease that has affected a lot of people, as well as claiming lives in the process. And as Bulawayo residents, let's also remember that we are also fighting, on the other hand, COVID-19, which is also claimed a number of lives here in Bulawayo and affected a lot of people. Let's keep our hands clean. Let's practice personal hygiene. Until next time, stay safe and protect your family as well as your loved ones.